sensory play is not about just getting a bunch of sensory toys, right? It's really something that needs to be integrated into the holistic approach to the child. So it's really about understanding the child's sensory profile, how they experience the world, both externally and internally in themselves, and then using that knowledge as a portal to building a connection with that child and supporting them in being more able to function in their environment, not so overwhelmed and even traumatized by it, but also more aware of it as you walk this walk together as a parent or a teacher or whomever, so that you can support relating, communicating, and learning. When autistic kids come in for assessment, typically it's because there's some kind of problem going on, irritability or some other kind of problem with perseveration, stuff like that. And what I really get concerned about is when people jump to medication for irritability, when many times those problems that the kids are having have to do with their sensory experience, right? They may be irritable because of the light in the room or the sound or things like that, or they may be inattentive because they're not responding to their sensory environment. So it's really important to investigate that before jumping to medications for irritability or for attention. We need to try to address the underlying problem. We're all familiar with the usual kinds of senses, right? So smell is really big, as well as taste and sight and hearing and touch, right? So for autistic kids, they may be hyper or hyposensitive to different parts of their environment and all those. So going through those and also remembering to look at the interoceptive sensory experience, what's going on inside your body, any kind of discomfort. So it's actually helpful to help parents catalog their kids' responses in their sensory environment about what things bother them or what things they're not responding to. And the kinds of signs that you might have trouble are if the child is in like a busy environment, what is it about that busy environment that's bothering them? And once you understand all those different sensory differences, you can start to figure out, well, how do I help the child do better? Either pay attention to the things that they otherwise wouldn't, and usually you do that through your own relationship with them, or help them to learn to tolerate the things that are in their environment that are very difficult. And again, you can do that through your own play, your own relationship. So when we talk about sensory play, we're really talking about using the relationship with the child to help them understand their own environment and work within it as we support them in developing their capacity for relating and communicating and learning. You're a busy pediatrician, you're in your office, somebody comes in and you're trying to, support them, especially if they're waiting for services, right? It's so hard to get an assessment for autistic kids or kids you suspect of being autistic. And then it's hard to wait for services. And while that's happening, what do you tell a parent to do? Well, in every interaction during the day with whatever caregiver, parents, grandparents, or others, if you can help people to be mindful and curious about the child's experience of whatever it is, eating, bathing, dressing, playing around in the yard, things like that, you can think about what might be helpful to the child to expand their world a little bit and their tolerance, as well as to help them pay attention to things they otherwise might not. So, just as a great example, so many autistic kids have feeding problems, ARFID, right? Avoidant restrictive food intake disorder. And we really defined that more in the DSM in 2013. But that doesn't, having that word doesn't help, to help a kid eat more. You've got these kids who will only eat like white bland food or something like that. Well, if you're aware of these things and paying attention to them, you can slowly shift what that child is eating. So they might only like a certain kind of fried chicken, and you're like, well, we've got that, and we've got a little bit of this other kind of fried chicken, and then you're slowly moving them towards something that's a little less fried and a little bit more healthy, very gradually over time. So it's just one example of trying to shift how a child will tolerate the world, part of their sensory environment, and it really helps their health. It is most helpful if you've got guidance from somebody who's pretty good with these things. A great occupational therapist, sometimes other people who do developmental relationship-based approaches can do this as well.